growing number of guidelines are definitely promoting the idea of team-based care. And here at the CV Summit, one of the topics here indeed is team-based care dynamics and roles. And I am talking with Dr. John D. Baker, who is the Director of Invasive Interventional Cardiology and Cardiac Cath Labs over at Anaheim Regional Medical Center, and then the Pacific Cardiovascular Associates in Irvine. First off, thank you very much for your time. This is a topic that it's very important. In terms of team-based care, what were you discussing? What are some of the take-home points?
Sure. The take-home points were essentially that since medicine is changing, we have to become more efficient in all aspects of how we deliver medicine to our patients. So one of the things that is the most, in my opinion, the most important thing to be more efficient as a healthcare delivery system is to develop the concept of team-based care. So we had an excellent session with a kind of a ground's eye view of, number one, how to set up teams, who they consist of, and then also why we should set up teams to deliver healthcare with the increasing need for more care, reduced reimbursement, higher access.
What works, and probably more importantly, what the hell is it that just doesn't work, and we know that now?
Sure. Well, unfortunately, a single person, entity, a physician managing every aspect of care, managing every aspect of outpatient care doesn't work. If that is the new paradigm is, if that were to actually occur, the person would likely have to work 20 hours a day, which is just not feasible. But when you take the task that you know that can be done by others of your staff, and you train those staff, not only do you create a team around you that wants to be involved, because you'll find that, or when you start instituting things like this, that people who are engaged, your staff who are engaged, will step up to the plate, do more education, will learn how to do more, and they'll be more engaged. You'll have better employees, you'll have longer lasting employees, et cetera. And then you'll have an overall improved workload.
What role is there for dyad leadership?
The leadership of teams is very dynamic. So the leaderships of teams can change, and it changes per patient, it changes per situation. So it's not always physician is leading this particular charge or an administrator is leading this particular patient. For a specific topic, it might be a nurse practitioner who is leading for that particular patient. So it's all going back to patient-centered care. So it's a concept that I think, trying to fit into a box, it doesn't fit as well, and it varies depending on what the patient actually is in.
What are the hallmarks of a really good team?
Communication, that's actually probably number one, communication between team members. So everyone is not working in a silo, everyone is working together to do the same things, to take care of patients, things that need collaboration with others. That's probably number one. Number two is every person working to their extent of their licensure and education. So if you have team members, for example, if you hire a physician assistant and you only have them do treadmills, that's probably not the top of their licensure. They can do so much more. So again, and your nurses, MAs, lots of your team can do much more. So top of your licensure, good communication, and then a good sense of we're doing this together. So having a cohesive team, making sure that everyone knows what their roles and expectations are. So those three things I think are very, very paramount in creating a good team.
I think TAVR, the whole new technology came along, and that was the first time that from the get-go a team was required. Mm-hmm. It wasn't just slightly recommended, it was really required. What other teams do you have?
There's several teams. So TAVR team, as you mentioned, structural heart teams. There's CHF, congestive heart failure teams. There's going to be more teams that are going to be debated for the outpatient setting. So we hear about the medical home concept quite a bit. That is something that is uniquely and uniquely for the team-based care. So team-based care could very well do things like out-of-home medical care, and there's so many different things that can be done with team-based care.
So you're also part of a team at the ACC that is kind of promoting teams.
Yes.
Tell me about that.
So I am the co-chair of the ACC Cardiovascular Care Team and Council. So we have been in existence for 6 years now. So essentially we're a collaboration of team members across the nation, nurse practitioners, physicians, PAs, pharmacists, administrators, who all recognize that we now need to act as a team. So we're the largest growing group in the American College of Cardiology, and I think that's right because it's something that its time has come.
Yeah, it's not going to get any less. In fact, the emphasis is going to be in the opposite direction more and more. Mm-hmm. Well, this is just one of the topics here at the CV Summit 2015. Please see the February cover for CardioSource World News. For the rest of the story, I'm Executive Editor Rick McGuire.